is American Heart Month. Heart disease is the leading cause of death for both men and women here in the United States.
But there is some good news. It is also one of the most preventable. Cardiologist Chris Vijay with Abrazo Heart Hospital joins us here on the couch this morning. You know, I want to read this stat to you because this just boggled my mind. More than 17.9 million deaths each year because of this.
Absolutely.
That's insane.
Yeah, it is insane, isn't it? So, but the reality is that, you know, heart attack happens and 600,000 people die every year, but then you can certainly prevent it.
Yeah, how is it that it is the leading cause of death, but also the most preventable disease?
Oh, absolutely, because most of this death is coming from changes that you can actually make purely by lifestyle modification. You know, stop smoking, you can eat lots of fruits and vegetables, decreases a heart attack by 30%.
Wow.
Decreasing your stress level decreases your heart attack by 30%, like you do yoga, right, Anita? So that itself is a very powerful modality that will prevent a heart attack.
Good to know.
Absolutely.
Now, you obviously have to have a pretty good relationship with your doctor and be getting these checkups regularly. I went into the doctor the other day and they're like, yep, you're over 30, time for an EKG.
He's not going to say
like,
hello.
oh, so like when should people start to really think about heart health?
Or changing.
Actually, the Pediatric Society is recommending you start getting your cholesterol checked at age 10.
Wow.
So do you know your cholesterol type?
No idea. Oh, no.
I know.
You know
I
the
don't know my
license plate of your
numbers.
car number. You don't know your cholesterol number.
Yeah.
So cholesterol, blood pressure checks as early as, you know, 10, 15 years of age. Diabetes check. I see 15, 16-year-old getting diabetes, type 2. I'm not talking about type 1.
How often do you need to have these checked and monitored?
Well, so it's called A1C for diabetes. You check it almost every 3 months, and then you make sure that it's not going more than 6.5.
That's if you're at risk. But if you're healthy once a year, is that reasonable?
Yeah, once a year, absolutely,
Okay.
more than enough. But, you know, make sure blood pressure, diabetes, smoking are the 3 major ones. And then, of course, after that comes your cholesterol, and then eating healthy, exercising, and then decreasing your stress level. These are all very important. Inner strength, self-discipline, you can completely change the whole paradigm.
Wow.
What about genetics, though? My grandmother, for example, has heart disease. She did not exercise. She did not eat healthy. I'm trying to convince my mom that she needs to, and then that's why I try to live a healthy lifestyle. Can you avoid genetics at all in any way?
Well, you can actually prevent the environmental factors and make sure that 90% of it, the heart disease is caused by environment, maybe 5 to 10% genetics, but just because you're genetically prone doesn't mean that you're destined to have a heart attack. You can totally prevent the onset of your first heart attack just by modifying the things we talked about, even if you are prone, because almost everybody in the family has somebody with a family history of heart attacks.
You brought some interesting looking props. Tell us about those.
So we have now so many things we can do above and beyond just prevention of heart attacks. Now if you have what is called a aortic valve, is one of the major valves in the heart. If you have this aortic valve that is tight, narrowed, or leaking, you can actually place this valve without cutting the chest open. You can go from the groin and implant it. It is actually right here. I'm showing you, this is your aortic valve inside this can, and that's where it goes. And we can do this, and they actually get out of the hospital the next day.
Unbelievable.
And you can do all kinds of things. You can do procedures. We can put stents inside the arteries in the carotid arteries and prevent a stroke. And then if somebody has what is called congestive heart failure, you know, it's a bad term. Failure is not a good term. We're going to call it dysfunction. The heart doesn't pump well, with the pressures inside the heart increase. And we can actually monitor the pressure with an implantable device as thin as a paper clip.
Wow.
It's
Look
right
at that.
here,
Didn't
and
even
that
see
goes
it.
into this artery inside this artery. And we can then put a wand outside the chest, or they lie on a pillow. We can get all these pressures from a distance and then make an impact on treatment strategy and make them feel better, live longer. So
Fascinating.
a lot of stuff,
It
a lot
is.
of stuff.
Great advice. Eat healthy, exercise, don't smoke.
Oh, very simple message,
There we go.
Anita. Very
Thank you,
simple.
doctor, for your time.
Thank you
Appreciate
for
it.
having me.
Thank you so much for
having
coming
me.
We'll
in.
be right back, everyone.